The World Health Organization says the number of cancer cases in Asia is expected to increase by a whopping 65% over the next 20 years, and the number of deaths could go up by 77%.
Here in Singapore, cancer is the leading cause of death. But why is this happening? To help us understand, we have with us Dr. Ravindran Kanesvaran in studio with us. He's a senior consultant at the National Cancer Centre. Dr. Ravi, thanks for coming in. Give us a sense then of the big picture of cancer in Asia. Why is there this increase?
As you know, Asia is the biggest continent, so 50% of cancer incidents in the world happens in Asia, and 57% of mortality happens in Asia. So cancer incidence is on the rise in Asia. This is partly attributed to better healthcare standards, and that leads to longer life expectancy. And with aging comes cancer. Cancer is kind of a disease of aging. The other thing is changing lifestyles. A lot of Asian countries, especially in urban areas, we have lifestyles that mimic what you see in Western developed countries. And lifestyle definitely is one of the causes why cancer is increasing as well.
All right, so if we were to cut these statistics for our regional viewers around Asia, based on the different regions in Asia, the different countries in Asia, do we see any differences? And in that mix, where does Singapore stand?
Okay, so there are a few ways to divide the regions. One is by their income levels, but what you'll see is within a particular region, there's also disparity. There are high-income countries, there are also low and intermediate income countries. So income levels could be one way to see this difference, because with high-income countries, again, you know, longer life expectancies, etc. Where does Singapore fall in all of this? I think we're quite fortunate. We have a good healthcare system. We have access to most drugs. Usually there's a lag in terms of the approval of these drugs by FDA, for example, and by the time it reaches any of our shores, including, you know, developed countries like Japan and Korea. But I think our local authorities have been working very hard to ensure that they do their due diligence rather rapidly and get these drug access to us. I guess in Singapore, the game changer was the initiation of MediShield Life, because the other big thing about cancer care is the cost of these drugs. Really very expensive. So MediShield Life has come in a big way to support a lot of these cancer patients. Of course, with some of the more recent drugs, they're very, very expensive. So the ministry has formed a health technology assessment unit called ACE, Agency for Care Effectiveness, and they do a lot of research on value-based care. So it's not just about the absolute cost of the drug, but what value does it give to the cancer patient in terms of quality of life, in terms of life prolongation. So these are some of the things that Singapore has in place. So in terms of training and manpower, I think we are on par with some of the developed countries as well. So I think there's more to be done, but I think we're doing reasonably well.
Yeah, could we just back up a little bit? Something you said just a while ago about how as the population ages and people sort of live longer, they are more susceptible to cancers. Could you help us understand that? Because Singapore does have an aging population.
Yes, it does.
You're almost saying that inevitably more people in Singapore will suffer from cancer of some kind.
Unfortunately, yes. The reason for that is as we grow older, we obviously take on more mutations, and the risk of cancer just increases with that. So aging is it's a major risk factor for the development of cancer. So it's inevitable. We're going to see cancer rates rising. It's already #1 in terms of mortality. The question is, are we prepared to take on this silver tsunami and the cancer incidence rise that comes together with it?
I like the way you say the silver tsunami, because you've just come back from the Global Congress, which is held by the European Society for Medical Oncology. Are we all on the same page here? Are there priorities mirroring what's really happening out there?
Yes. So this Congress was by the European Society of Medical Oncology, but in reality, they are a global organization of about 24,000 members who are scientists, physicians, etc. And about a quarter, 25% of the membership are Asians. And that is why they held it here in Singapore. In fact, we, the Singapore Society of Oncology, have a close partnership with them. So this is the 5th edition of this event, actually. And their priority for Asia is to see improvement in cancer care. And that's from various angles. One is from education. They hope to be able to run programs to train more oncologists. One issue in Asia is that we are lacking in cancer specialists. So if you talk about manpower, in India, for example, there's 1 oncologist for 1 million population. In the US, it's 161 oncologists per million population. So you see the disparity there. There are also issues with costs, because cancer costs is rising. So they come up with new tools that can help us, evaluate these drugs. So there are a few elements that they've brought in that they have, done successfully in Europe into Asia with the hope of improving cancer care for all our patients here.
All right, that's very enlightening, very interesting. Thank you, Dr. Ravi, for coming in and speaking
You're
with
most
us.
welcome, and thank you for having me.
He is a senior consultant at the National Cancer Centre, Singapore.